We now get to turn to a really interesting conversation about what it looks like to implement food as medicine programs. Moderating this session will be Dr. Dariush Mozaffarian of the Food as Medicine Institute. Round of applause for him, please. Joining him, we have Hollie Harris, the President and CEO of Appalachian Regional Healthcare. Round of applause. The dapper Dion Dawson, the founder and chief dreamer for Dion's Chicago Dream. Give him a round of applause. Dr. Kofi Essel, the Food as Medicine Program Director at Elevance Health. Round of applause. And Pam Schwartz, the Executive Director of Community Health at Kaiser Permanente. All right, Dory, my friend, over to you.
Thank you so much. I have a terrific panel, and then after this, we have a couple of congressional speakers as well, and then we're gonna close. So, you've seen the cross-sectoral support for food as medicine, the cross-national support for food as medicine. This panel, I think, also really brings that together. I'm not going to introduce each person individually. They'll talk about their own experiences a little bit. I'm going to start with Hollie. As the leader of a healthcare system in Appalachia, serving low-income Americans in Kentucky and West Virginia, she's been really doing a lot about food as medicine. Why are you passionate about food as medicine? And tell us what it has taken to do a systematic approach for your employees and also for your patients.
So thank you, Dari. Thank you for having me here today and looking forward to this discussion with this great panel. So I'm Hollie Harris. I'm the President and CEO of Appalachian Regional Healthcare. We have 14 hospitals across eastern Kentucky and West Virginia, about 95 clinics. We operate home health, DME, retail pharmacy, and a couple medical spas as well. And we serve a very rural population of about 350 to 400,000 people. And we see some of the sickest patients that you can imagine in the United States of America. We have the highest rates of obesity and diabetes that exist in this country. And the mission of our health system has always been to improve the health and well-being of the population that we serve. And honestly, when I became CEO about 3 years ago, I realized that we had failed that mission because we had been solely focused on sick care because of the reimbursement models that exist in healthcare. So we have really been working hard over the past 3 years to reverse that model of care and focus on the front end of healthcare and making sure that we are changing the lives of not only the patients that we serve, but starting with our own workforce. And that has been our true systematic approach, is making changes with our own employees, implementing wellness initiatives, teaching them about food and nutrition, supporting our doctors as they get certified through the American College of Lifestyle Medicine. So we have really had to break down the whole system of healthcare delivery and find those gaps that have existed. So it's been a challenging time, and hopeful that conversations like this will draw more national attention and help us start changing the reimbursement models for providers.
And you've seen immediate results already with your employees and their healthcare costs. Can you just really briefly talk about that?
Yes, so we are self-insured for our healthcare plan, and our costs have gone down. You all just saw Crystal here. I'm so proud of her and the lifestyle changes that she's made for her and her family, and she's just one example of the workforce that we have across ARH. Our employees are happier, they're more productive. We have changed all of the cafeteria operations. We're labeling our food. We have salad bars. We're doing what we call hikes with Hollie. I organize hikes and take my employees out hiking after work. So it's the little things. And as soon as we see our employees start to see those lifestyle changes, it's just catching momentum. And there are a lot of crystals out there across the ARH system.
That's wonderful. You talk about the little things. The congressional cafeterias have actually improved quite a bit over the years. There's actually some healthy options, but I will give a plea to all the staffers to clean up the junk food when Americans walk into your offices and there's a bowl of candy or junk food. Congressman McGovern has done a terrific job with dark chocolate and pistachios and some other healthy choices. So we got to do the little things, even in the halls of Congress. So this panel is really about the front lines, and there's few more favorite folks I can think of on the front line for me personally than Dion. So Dion, tell us a little bit about your background and how you arrived at the work that you do, but what you're doing in Chicago.
Absolutely. I also want to add to the historical record that Kofi is also dapper. So Dion Dawson, Chief Dreamer and founder of Dion's Chicago Dream. just a background about me. I fit a lot of different categories. So when we're talking about this work, I'm a black male from the South Side of Chicago. I'm a Navy veteran. I'm a nonprofit founder, and we have implemented and scaled a lot of food as medicine work. And so just from my vantage point, I'm able to, not only listen, but also make sure that I'm encouraged and intentional about how all of these things connect. A little bit about what we're doing in Chicago. We started an organization less than 5 years ago, not focused on food as medicine, not focused on food insecurity, but just trying to have some type of response in the pandemic. But the good thing about all of this is that if you actually pay attention and hold yourself accountable to having tangible impact, and you're going to start learning more and more. You're going to start asking yourself, are we being as impactful and as efficient as we could be? And every time myself, my Vice President Danielle, and the rest of our leadership team would ask that question, we realized that there's more we can do and there's a lot of tweaks that we could make. And so what started with the community fridge in Chicago with $20 has morphed into a $7 million organization that employs people from the community. We've actually never recorded a single volunteer hour. We're providing about 200,000 pounds of fresh produce that we purchase, pack, and deliver. So we've provided about 4 million pounds of fresh produce, and we've never utilized anything that has been used. And so we actually are active players in the market. We understand the economics of it. We don't shy away from some of the capitalistic values that we have to hold in order to be successful, but we hold ourselves accountable to ultimately trying to have people live longer and healthier lives. And so in doing that, what started with a direct-to-home, direct delivery project and pilot on 2 blocks in Chicago has now scaled to us delivering in 170 zip codes and 4,300 households per week. And in doing that, we have also implemented internal community health workers doing biweekly qualitative touch points so that we can understand, how they're initially responding. We partnered with Food Smart to make sure that we can track outcomes as we're doing that. And also, even with our partners at American Diabetes Association, we've been able to do a lot of different research in terms of how that's affecting people. And so on one hand, I'm always excited to be here. On the other hand, I'm extremely confident in what we've been able to do. This is not a pilot anymore. We've been able to scale it and sustain it and do it in a way where we really understand that in order to land this moment, food as medicine cannot be on top of a broken food system. So what we've decided to do was, while we're scaling food as medicine, fix last mile delivery so that we can have as many insights as we need to. And we've been able to do that in Chicago in a way that has not only been transformative, but it's allowed our work and our strategy to connect to, the regional and federal levels. And so it's really exciting.
So you're supporting health, you're supporting local farms, you're delivering food to people in need. Talk about the mix of funding, charitable versus healthcare funding, and how that healthcare funding has ramped up, and what would be helpful briefly to make that grow.
Oh, absolutely. Anybody in here that can write a check or do an MOU, see me after, please. I think that, ultimately, when we talk about sustainability, we always, shirk at, the idea of making money because we want to, put ourselves out of business, right? Well, that's not going to happen. We are unhealthier. We're, staring down, the barrel of potentially, more years of what we just came from in terms of households and the cash that they have on hand. And so in doing that, when we started, of course, it was a traditional, nonprofit, whatever grants we can get, we just go for it. But ultimately, in connecting with the food as medicine work, what we've been able to do, because we have the fresh produce and we can procure and we can deliver, we've been able to collapse 2 parts of that supply chain. And so going over the last 2 years, growing our earned revenue from 0 to $500,000 to $2.1 million, and then using that to stabilize all of the offerings that we have.
From healthcare dollars.
Yes, absolutely, absolutely. And so that's allowed us to continue to grow and stabilize it, because I think ignoring the market opportunity is kind of what got us here. I think we have to balance those things out.
Yeah. Thank you. And so another one of my favorite Frontline champions, I had something to do with the panel, so a lot of the people here are my favorites. So Kofi, Elevance Health is one of the largest payers in the country, covering, I may get it wrong, 45 million lives, I think. Really tremendous, almost 1 in 6 Americans. Why does Elevance Health care about food as medicine? Why are you the food as medicine director at Elevance?
Yeah, great question. Great to be here today. Really excited to talk about some of the work we're doing. The way we kind of think about food as medicine, it starts and ends with us with this concept of whole health, right? Whole person health. How do we think about the factors that influence health outcomes inside the clinic and outside the clinic as well, recognizing that these factors are key in influencing short-term and long-term health outcomes. We've seen our members, our patients, our families asking for these kind of programs. We've seen the impact of these programs. We see the data. We see the skyrocketing rates of these chronic diseases, these diet-related chronic conditions, and we wanted to respond to that. Food as medicine has been something we've been doing for many, many years at Elevance Health, but more recently, we've really focused and gone away from just primarily thinking about it through sort of an anti-hunger lens to more thinking about it through that really, truly food as medicine, diet-related chronic condition lens as well. When we talk about food as medicine, we usually use a definition like this. These are strategies or interventions that work alongside healthcare, that give access to high-quality, nutritious foods, focused primarily on three things. How do we prevent, how do we manage, and then how do we treat disease? We heard earlier, we can even talk about how do we put diseases into remission, something in medical school as a community pediatrician we didn't talk much about. I knew how to slow things down, potentially, but how do you get at the root cause and actually heal conditions? What a lot of us went into this for. This is an opportunity that we can't turn away from. When we think about food as medicine, our approach at Elevance Health, we have sort of three main goals. Number one, we want to implement food as medicine through every single line of business, commercial, Medicaid, and Medicare. Right? We don't want to just hyper-focus on one line. We think that's critically important. We want to make sure we are advancing a digital-first approach, when possible, to food access and education. High-quality education, high-quality food access, throughout the region, city, zip code, county, wherever we can. And last but not least, we want to lean into advocacy. But the way we want to lead into advocacy is in a few ways. We want to invest in research, building a stronger business case, invest in education, creating dynamic partnerships with phenomenal community-based organizations like many of you all in the room right now, and make sure we're advancing the thought leadership in this space as well. Our foundation has also been a key contributor to this work, thinking outside of the realm of just our members. In the last 3 years, we've supported food as medicine with over $30 million, and we're actually about to re-up that in the coming months as well with more investment in food as medicine because, again, it works, and we want to see it continue to scale around the country.
Thank you, Kofi. I think, when you have one of the largest payers in the country really believing in this and trying to scale it, you show that there's real value here. And so speaking of large healthcare, Pam leads community health at Kaiser Permanente, which is one of the largest integrated health systems in the nation across 14 states and D.C. And so similarly, as I asked for Kofi, how do you see food as medicine? How do you think about leading food as medicine across Kaiser Permanente?
Thanks, Dari, and it's such an honor and a privilege to be here and to see so many familiar faces in the audience, and I'm sure online as well. And I could say ditto to a lot of what Kofi said, and probably a lot is because we've been working together on really transforming the way we treat and prevent diet-related disease and address hunger as a nation. And I think the reason that there is standing room only in this room is because that's something we all have in common, and more we're seeing food as medicine woven into the fabric of healthcare. So I think I'll answer your question a lot with a ditto of what Kofi said, but I want to add one piece because I think there's something missing from the conversation that we've had with all the panels so far, and I just want to emphasize that for healthcare to fully embrace food as medicine as standard practice, so in a sustainable, scalable way, we have to continue to build the evidence and the business case about what works and under what conditions. And Kofi mentioned it, but I just want to put a pin in it because while the evidence is much better than it has been and a lot better, still we need to make sure we're focusing on the right disease categories, the right target populations, and with the right interventions and for the right durations to get to the impacts that we all want. And so to maybe just put a pin in more answering your question, Dari, we're trying to marry the evidence and watch how it evolves with the best practices that we learn from our partners and ourselves. We're trying to build the evidence, and also we're trying to listen to our members and patients and communities about what matters to them, and then build investments and interventions that respond to all of that. And together with Tufts, we're leaning in, co-creating a food as medicine toolkit to really put pen to paper in a very practical, pragmatic way on how can we help health systems like us and community, all the community clinics and everything in between with what does it take to deliver food as medicine on the ground. So what are the practical interventions? What's the evidence-based? What are the tools and best practices? And give something back to the nation to really make sure that we're all implementing with quality, with evidence, and with and not reinventing the wheel as we deploy this across the nation. And what I also want to say, and you've heard this through all the panels, is there is so much enthusiasm in the nation for this work. We heard it from everyone, and I'll just add that it's in my own organization as well. I have been at Kaiser Permanente for 25 years. I hit 25 years like in 3 weeks, I think. And I have never seen so much enthusiasm for a topic area. An all-hands-on-deck approach and really wanting to figure out how we can lean into this, what's the best evidence, who are the right target populations, and how do we embrace this inside healthcare in a meaningful way and a cost-effective way. And the way to do that is making sure that we're using the best evidence, learning as quickly as possible, and also building the business case for what works and under what conditions, and then translating that into standard of care and workflows and making sure that it aligns with what our members and patients want as well. So I have so much optimism for what's possible here, and I think all of our panels demonstrated different versions of that, but I just wanted to add the importance of the evolving evidence, but translating that into practice in a sustainable way.
Thank you, Pam. And talking about the business case, Kaiser and Tufts have together, with Elevance as a member, founded a national network of excellence, bringing together some of the largest payers, insurance payers in the country, who are together, in a non-competitive way, saying what is the business case and how can we really advance this? And then I think the second point I want to make to what Pam said about the evidence, right? We know nutrition works for reducing diet-related chronic disease. There's been dozens and dozens of randomized controlled trials that have shown many, many benefits. So really, it's now a question about implementation. And I think about, as a doctor, blood pressure lowering medications. When the first trial was done and showed that, giving somebody a blood pressure lowering medication lowered their blood pressure and prevented stroke, the drug was approved. And now we've had 50, 60 years of science to try to understand who do we give it to and what dose, what combinations, how do we get people to take it, how do we improve compliance. But the whole time the drug has been paid for and allowed that research to take place. It's time to do that in food as medicine. We don't need to figure out 60 years of implementation science to get the treatment approved. The treatment should be approved, paid for, covered, and then really determine who it should be for. So I think we have about 1 minute each for kind of quick answers. I'll just go down the line and say, ask each of you a question. So Hollie, given your payer mix and the region you serve, what are the barriers to the food as medicine programs, and where do you go from here, particularly thinking about the office staff in here and online?
I think the biggest obstacle right now for us is the payer side of the equation, but we're trying to get around that in creative manners by forming partnerships. And one of our key partners in the Commonwealth of Kentucky is our Department of Agriculture. And our Ag Commissioner and I are the state co-chairs for Food as Medicine. So we have got to find other resources. And one of those is working with our local farmers, which economically benefits them to get their fresh fruits and vegetables and protein sources into our cafeterias, feeding our patients, feeding our employees, and it boosts them economically as well. So there are definitely barriers out there, but we have to just find creative solutions right now, and they're out there. There are people that want to partner and work with us.
Yeah, that's terrific. And Dion, same question for you. What would you like to see Congress or others do to help the benefits you're giving to Chicago and more broadly to really take off?
Well, I think we just have to ask ourselves, what is the metric of success? And I think that what we want to do is pay attention. I think that, as we were riding over in the Uber, when we were talking, a sobering thought that I had was that, although this room is packed and there are a lot of people online, this movement is wholly dependent on everyone here. So if we all disappeared right now, we would lose a lot of traction. We have to continue to connect it back to the ground to make sure that we can get legislation, that we can get it in black and white, because until we do that, we are still on borrowed time. And there is an immediacy that we all have to have that has to connect back to the immediacy and the people that we're trying to save. If we are saying that people are dying, that we cannot come to DC and act like they aren't dying. We have to keep up that momentum. We have to make sure we're connecting, and everybody should leave here asking yourself, what am I not doing, and who am I not supporting, or who am I not talking to?
Thank you, Dion. Kofi, same question for you, or if you want, a different question, or 30 seconds. What would you like to see happen in Congress, and/or how would you like to see doctors be better trained and understand this better?
30 seconds. So I'm a doctor. We didn't get much training in food and nutrition. And the goal is not for MDs to become RDs, right? The goal is to build confidence, build awareness, build sort of the recognition of how we can then refer into all these programs. If we're building out this great infrastructure and doctors don't believe it's effective, we're losing out on that opportunity to build off of that trust with that patient-provider relationship. So it's critical that we invest in the education of providers, not again to become RDs, but to build this awareness and confidence and referral mechanism.
Yeah, and I think that should be across continuing medical education for practicing doctors, residencies, and medical schools. So Pam, you can have the closing word, 30 seconds. What would you like to see happen in the halls of Congress or the agencies or in states to really help us take off?
I mean, I think it's so exciting. And again, I'll repeat what I said because I think it's really about transforming the way we treat and prevent diet-related disease and allowing our frontline care delivery teams, like what Kofi described, to have more tools in their tool belt to treat and prevent diet-related disease and address hunger in innovative ways. And so I look forward to a future where food as medicine is more woven into the fabric of healthcare in evidence-based ways. And also, I know there is so much innovation going on across the nation, and so I look forward to just it getting better and better as we move this work forward. I'm super excited about this future.
So big round of applause for this panel. Thank you.